Welcome to a day in the life of rural reentry, the video blog of Remnant Initiatives. My name's Jody and I serve as the executive director at Remnant Initiatives. And people often ask us, why do you do this work? The answer, because over 95% of everyone that we incarcerate in this country is going to come right back to your neighborhood. And it's in the best interest of all of us to ensure that they have the tools that they need to be successful, law-abiding, tax-paying, contributing members of our community. In our last video blog, we visited a day in the life that occurred back in October of 2018. And we learned that release day can be a really powerful turning point in someone's life in helping them to set the stage for future success. Today, I want to go back to a day in the life that happened just a few weeks ago. In this particular release day, we had everything set up. Volunteers were assigned and coordinated to go down to Salem and pick up our newly returning citizen neighbor. And then the governor's stay-at-home order happened. And when that happened, we got together as a leadership team and determined that we really didn't want to expose multiple volunteers from multiple households to the virus. And it was determined that my husband and I, we're empty nesters, we live alone, we can work from home, that we would be the ones that would go down and do this release day drive. Now, why was I so convinced that there was potential or danger for exposure? Well, it's because I've been working in prison ministry inside our prisons now for over 10 years, and I know what conditions are like. Bunks are very, very close together. Cells are small. Paper towels, soap, basic hygiene items are not always available. And many of the infirmaries in our prison system are old and ill-equipped to deal with infectious disease. So the potential for exposure is very high. So on that day, Dave and I took off for Salem, stopped at Caravan Coffee, picked up some coffee on the way out of town, and we're just driving down the 5, chatting away. And then that text that you hope will not come, comes. The first case of COVID-19 had just been reported in an inmate in the prison where we were heading, and we were not prepared. So I channeled my ex-public health nurse knowledge and started to improvise. We had Lysol spray in the car, which we'd been keeping in the car. We had hand sanitizer in the car, which we'd been keeping in the car. And we at least had the foresight to bring bandanas down, which we intended to wear in public while we were doing the usual release day drive errands on that day. So we pulled into the prison, announced to the gate guard why we were there, and while we waited for our neighbor, sat and chatted about how we were going to handle this. So we watched him walk out of the building with the usual 2 clear plastic bags full of his belongings. And as he left the gate and approached the car, I said, "Stop." And with the can of Lysol spray in my hand, I said, "I'm really sorry. I don't even know if this is gonna work, but could you please hold out your arms and your belongings and hold your breath? Because I'm gonna spray you down with Lysol before you get into this car." He was cool with it. We did so. He got into the car. We put the bandanas on and we started laughing because, well, ironically, we all look like bank robbers. It was a good day. Dave and I did our best to make sure that he didn't inadvertently expose anybody to disease he may have been exposed to in the prison. And we did our best to help rehumanize him back into community on that day. Thankfully, the Yamhill County Gospel Rescue Mission was still housing our returning citizens, so he had somewhere to go. The very next day, however, my guts were in a knot. And so I sat down to my computer and I pounded out this comprehensive and fairly aggressive protocol for how we in Yamhill County could get folks back from prison into our neighborhoods without exposing people to the virus. This plan included the use of county vans and hoteling people until we were sure that they were no longer contagious. And I submitted my proposal via email to the county sheriff, to the director of health and human services, to the director of parole and probation, and to a county commissioner. And within a day or two, they all responded. And they all responded with a very similar response. When something like, thank you, this is great, but we don't really know if this is our jurisdiction, and there isn't any money to implement something like this anyway. So who is responsible for getting newly released neighbors back into community after they leave prison? Well, the answer actually is kind of nobody. It's really just up to the person releasing to figure it out and to get back to the county where they're required to report. What this means is that many returning neighbors are just going to be getting on buses, potentially having been exposed to COVID-19 on the inside, and then reporting to wherever it is that they're supposed to go before the end of the day on release day. They could be spreading the disease while the rest of us are working so hard to try and contain the spread of the disease. No one in public health or corrections actually owns the trip from prison back to the neighborhood. And people release every day from prison into homelessness. So at this point, I set my sights on the people that we serve at Remnant Initiatives. It's only about 30% of everyone that releases into our county. It's not everyone, but we collaborated and we planned and we put together a process. A volunteer helped us obtain N95 masks so that we can wear those on release day. North Valley Friends Church is lending us a van so that we can keep 6 feet between us while we are riding back from the prison. Virginia Garcia Clinic is willing to set up telemedicine visits and drive-through COVID-19 testing on release day. But they've also asked us to make arrangements for the person being tested to be able to isolate in some sort of private setting until the results come back. And that may take 3 to 4 days. Thankfully, the mission is willing to provide a private room so that newly released neighbors do have a private place to stay while we're waiting for those results. It's not a perfect infectious disease control plan. And my public health nurse professors from way back when would probably give me a C+ for this project, but it's a start. And all of this has got me pondering this idea of accountability. I often hear people say, yeah, but folks who commit crime, they have to be held accountable. And so my question is it our intention as citizens, when we hold people accountable for committing crime, which is usually driven by untreated addiction, mental illness, or childhood trauma, is it our intention that when we're holding those people accountable, that part of their imprisonment is to be exposed to life-threatening disease, to crowded conditions, and poor health care, that then in turn makes us vulnerable when they get on a bus and return to community? And if the point of all this incarceration in America is to rehabilitate and to reintegrate our wayward citizens so they don't commit another crime, then shouldn't somebody be accountable for how they get back to community after incarceration? Remnant Initiatives is a small nonprofit. We have 21 volunteers, 1 very part-time staff person, and a handful of donors that barely keep this ship afloat month to month. Why are we the ones figuring this out? Maybe it's time for taxpayers to demand more from our criminal justice system, to start holding the people with power accountable for the outcome of their work. The outcome being the condition of the people that they send back into community to live with us. And maybe if everyone, from the police to the sheriff to the DAs to the jails and the prisons and community correction staff, parole and probation, maybe if everyone in this convoluted chain kept the outcome in mind, rather than just doing their part of the job. Maybe we could realize our collective dream for safer, healthier communities with less crime, even in the midst of a global pandemic. P.S. No one got sick from that release day drive earlier this month, but that prison, they've identified many more cases. Until next time, stay safe, stay at home.